Okay, we're starting the chapter on psychological disorders, chapter 18, so make sure you have that test guide printed out. And we'll be looking at the first two sections today. So here we go. So here's your introduction. Psychological disorders are behavior patterns or mental processes that cause serious personal suffering or interfere with a person's ability to cope. So in order to be diagnosed as a disorder, it has to affect your everyday life. 23% of people will have a psychological disorder at some point in their lives and can affect almost anyone. No one's immune. All right, so people with psychological disorders usually are not different from normal people. They just have some singularity that is the problem. Symptoms, diagnosis can be difficult. We'll look at some criteria used. Typicality, you compare someone's behavior to what is normal. This is a bit problematic because what is normal? If you've ever had the experience of going to a different culture, or maybe just, different families have much different way of doing things. So what is really normal? Maladaptivity. So this means behavior impairs individuals' ability to function adequately in everyday life. So you are not adapting to the ups and downs of life in a healthy way. So alcohol abuse is an example of maladaptivity. A lot of people use alcoholism as a coping mechanism to drown out something going on that they're not handling well. Emotional discomfort. So two common psychological disorders, depression and anxiety, can cause helplessness, hopelessness, worthlessness, guilt, extreme sadness. So that's a significant amount of emotional discomfort and leads people to suicide. And socially unacceptable behavior. So this is very culturally dependent. One culture is crazy, another culture is common. So you can see this in the textbook. There's a little chart or something, I think, where they look at different cultures and kind of different things they do. I remember being in a history class in college. Maybe I've told you this before, when I was in grad classes for my master's degree. And one of the guys I knew was married to a gal from Madagascar. And they have this festival or party once a year where they go and take all the bodies out of the family sepulcher, so they're dead ancestors, and then they basically have a party all day, and then they rewrap or wrap again the mummified remains of their ancestors and put them back in the sepulcher. Well, if you came to school, if we ever have school again in the fall, and someone says, "Hey, what'd you do this summer?" If you said, "Oh, we went to the cemetery and we paraded around with all of our dead ancestors and then for the day," people would be like, "You're crazy." But in Madagascar, apparently that's not crazy. So this is a bit problematic as well. So we do have a need for diagnosis and treatment and causes. And so we have this manual called the Diagnostic and Statistical Manual of Mental Disorders, or DSM. And there's several versions, and they try to catalog these things, looking at symptoms, treatments, etc. Okay, so that's kind of a brief introduction, the first section. And now we'll look at the second section, looking at anxiety. All right, anxiety disorders. So anxiety is a general state of dread or uneasiness that occurs in response to a vague or imagined danger. Fear, contrasting, is response to a real danger or threat. So anxiety, often vague or imagined. Fear, very specific, real, threatening. Characteristics of anxiety: nervousness, inability to relax, concern about losing control, could be irritability, lots of things. Physical symptoms of anxiety: trembling, sweating, rapid heart rate, feel like your heart is racing, shortness of breath, flushed face, etc. All the result of an overactivity of the sympathetic nervous system. That's your stress, right? Nervous system to prepare you for action. In this case, the action, I mean, there's not a real problem, but your body's preparing as if there were. So when is anxiety a problem? This is the bottom of page 1. When it interferes with effective living, when it interferes with achievement of your goals, with life satisfaction, with emotional comfort. So it has to be interrupting your daily life. So anxiety disorders are among the most common. I'll talk about that more in a second. All right, looking at the top of page 2 now. Might have this a bit out of order. You'll figure it out. So a phobia is from the Greek word phobos, which means fear. A simple phobia, so there's a definition there. You can do that on page 2. Is a persistent, excessive, or irrational fear of a particular object or situation. To be diagnosed, the fear must lead to avoidance behavior that interferes with normal life. I remember watching this little video clip where a woman is driving and there's like a spider crawling on her steering wheel. And so she literally jumps out of her car while it's moving down a residential street and her car just goes careening off. Well, that's a phobia, right? It interferes with normal life. If you can't, if you're going to recklessly endanger your life and others because there was a spider on your steering wheel, that's a problem. Common phobias: zoophobia, fear of animals; claustrophobia, fear of claustro. Actually not, it's a fear of small spaces. I was just trying to be funny. Acrophobia, fear of heights; arachnophobia, fear of spiders. We just mentioned that one. Phonestophobia, usually I have people guess these if we're in the classroom. But phonestophobia is the fear of beautiful women. Dentophobia, fear of dentists. Hemophobia, fear of blood. So, and there's hundreds of phobias. Social phobia, so there's a middle of the page, page 2, is a persistent fear of social situations in which one might be exposed to the close scrutiny of others and thus be observed doing something embarrassing or humiliating. Often those people who struggle with anxiety also have a social phobia because they fear they're going to do something embarrassing in front of a whole bunch of people, and then that makes them avoid groups of people. Panic disorder is recurring and unexpected panic attacks. So this is at the top of the page: symptoms and characteristics of a panic disorder. Panic attack, relatively short period of intense fear or discomfort characterized by all the physical symptoms of intense anxiety. So you feel like you're going to die, your heart's racing like crazy, shortness of breath, just a really terrible, kind of like if you've ever been underwater, like someone's dunking you and you couldn't get up and you kind of thought for a minute, you panicked like you were going to drown. I mean, that's basically that fear of drowning intensity. For many, there's no apparent cause. Many people have a fear of having a panic attack in a group of a bunch of strangers. And so that leads to agoraphobia, which is the fear of public spaces. So that's 3/4 of the way down the page. I'm sorry I didn't put these in exact order. I don't know. I just wanted to keep you on your toes, I suppose. So agoraphobia comes Greek. The agora was the marketplace of ideas. So it's like public spaces. So fear of public spaces, 50 to 80% of adult phobias are treated clinically. Many are afraid of having an attack public place. We talked about that, leads to avoidance of public places. All right, generalized anxiety disorder. This is also near the top. Excessive or unrealistic worry about life circumstances that last for at least 6 months. So everyone has anxiety. I mean, you probably have anxiety before a big test. You have anxiety before a job interview. You have anxiety about going to college. You have anxiety about COVID-19, whatever. We all have anxiety. It's just a question of, is it interfering with our lives for more than 6 months? So it's one of the most common anxiety disorders, though few seek treatment for it. Okay, before we get to OCD, so you were supposed to, let's switch over actually, and look at this article that you were supposed to read about anxiety. So I shared this earlier this week. So it's written by a young person, and I'm not going to obviously read the whole article with you, but it talks about general anxiety disorder, affects 18.1% of the U.S. population over 18. Most don't receive treatment, and that there's people in our churches that suffer from anxiety as well, and there's a bit of a stigma there, right? She says taboo, where people don't want to talk about, they see it as weakness, right? Like I have an anxiety problem. That means I have a weakness, and our pride inhibits us from talking about our weaknesses. But if you broke your arm, would you not seek treatment because you have a weakness, that is your broken arm? No, for physical problems, maladies, we will seek treatment, but for mental maladies, we often avoid treatment, and that's messed up. So general anxiety, restless, wound up, irritable, difficult time concentrating, muscle tension, extreme fatigue, difficulty controlling your feelings, panic attacks, your heart can go crazy, trembling, shaking, shortness of breath. So if you read the article, this is about this young person who was very busy and was seeking perfection, specifically looking at courses, been so invested in all the things they were doing, they were a bit isolated, overcommitted, and just thought that they could hack it. So there's a pride there of like, I can do this. Then they had a panic attack that was really bad, ended up vomiting blood, which is crazy, meaning like how difficult that experience must have been. Then despair, trauma. She tried to go back to doing things as she had done before, like, I'm through this, I'm over it. And because of her ignorance, it happened again. And here's a key: when mental illness fuels physical illness. A lot of people struggle with anxiety or depression, and then it manifests itself physically. You'll have, like if you have too much stress, you'll have extreme stomach pain or headaches or other physical things that your body's telling you your mind's not right. There's a problem. And then it says that she eventually went to a psychiatrist. Remember, a psychiatrist is a doctor who can prescribe medication, where a psychologist cannot prescribe medication. So then this just says, hey, this is a small amount of what's going through, and then she directs us back to God's word, because there's a lot. I mean, read the Psalms. She mentions one psalm here, but read the Psalms. David went through so many difficulties, between being chased by Saul, to his own son trying to kill him, to his own sin. And there's all these different Psalms where you can read them and can be very comforting when going through anxiety. Now, 1 in 3 young people today will suffer from anxiety. It's a very growing problem. There's been over a 20% increase in the last few years in anxiety in young people. And part of that social media, we know that. Just the always connected. Like when I went to school, you had all your social stuff at school, blah blah blah, and you'd go home, and unless someone called you on the telephone, which wasn't incredibly common, you could go to your part-time job and you could hang out with your family or do whatever you did, and you were sealed off from all the drama of school until you went back the next day. Well, nowadays, because of social media, you are literally connected to your classmates 24/7, and some people never shut that off. And so instead of like having the healing uh, surroundings of a family where you get encouraged, etc., you're just always bombarded with the social aspect of school, and that can be really draining on people and in part lead to anxiety. Hospitalizations for suicidal teens have doubled in recent years, and so this is a problem. And if you're someone who struggles with anxiety, or you know someone who does, then you should seek counseling to help before it gets worse. And CBT, cognitive behavioral therapy, is very effective treating anxiety. And in this gal's case, they do prescribe SSRIs, which are actually SSRI stands for selected serotonin reuptake inhibitor. We'll talk about that later in the chapter. But it's basically an antidepressant. They have found that that's helpful treating anxiety. And yeah, so I would encourage anyone who's struggling with anxiety over a long period of time to seek help, because learning, cognitive behavioral therapy is just learning how to train your thoughts, how to examine yourself, and how to progress through the difficulty. All right, so yeah, we're really missing out on a good discussion here. I know that, but it is what it is. So let's go back and look at excessive obsessive compulsive disorder. So obsessive compulsive disorder, also known as OCD, I posted 2 videos on Moodle about OCD, and obviously they're assigned. You should watch them and realize what OCD really is. And one of the themes that's in both videos is just the idea that our culture uses OCD to describe mundane behavior, and it's really inappropriate. So don't be a kind of person who says, "Oh, I'm OCD because I'm neat." It's not really what it's making light of a disorder, but they'll explain that. Okay, so obsessions are unwanted thoughts, ideas, or mental images that occur over and over, and compulsions are repetitive ritual behaviors, often involve checking or cleaning something. Make sure you star those in your notes because people get them confused all the time. So obsessions are the ideas in your head. The compulsions are the actions. So some people have like a security compulsion where they're checking to make sure doors and windows are locked like 80 million times before they go to bed every night. Some people, it's germs where they're like washing their hands all the time. They can't touch things without feeling contaminated. The girl on the YouTube video I shared, the TED Talk, has a balance OCD thing, and you'll probably find that pretty intriguing. Meaning it's intriguing to discover what some people go through. And so you might, on the bottom of page 2, describing OCD, after you watch those videos, it'll help you describe them better. And then the point there, when people say I'm so OCD, what does this mean? You can use the videos to answer that question too on the top of page 3. Now the rest of this stuff doesn't have a specific spot in the notes, just kind of goes along. So stress disorders, PTSD, and acute distress disorder have similar symptoms, but different how quickly they occur after the traumatic event that triggers the disorder and how long they last. So PTSD intense, persistent feelings of anxiety that are caused by experience so traumatic that it would produce stress in almost anyone. Rape, severe child abuse, assault, severe car accident, or different kind of accident, airplane crash, natural disasters, war. So I'm just teaching the Korean War and the Chosin Reservoir to my high school history students. And yeah, we watched this documentary. You probably remember it, on the Chosin Reservoir, and these Marine veterans talk about the Chosin. And one guy's like, I didn't even have any problems until like 40 or 50 years later. I was asked to give a talk about my war experiences, and I started crying like crazy. That's PTSD. Another guy had bad dreams night after night after night after night about the battles. That's PTSD. So, flashbacks, nightmares, numbness, avoidance, sleep disturbances may occur 6 months or more after the event. Like I said, in this case, the guy was decades. Acute stress disorder is a short-term deal. So it says symptoms occur immediately or at most within a month of the event, lasts a few days to a few weeks. And so this is like, it happened, you go through something stressful, and then like a car accident or something traumatic, and then it bothers you for a few weeks, and then event or a month or so, and then you get over it. That's not PTSD. PTSD lasts a lot longer, is much more severe, can show up many months, many years after it happened. So that's the difference there. These are just ways to try to explain anxiety. So the Freudian school psychoanalytic says it's probably because of repressed childhood stuff. That doesn't have much weight, we've learned. Learning theory, learned in childhood, maybe observed. So, and there's some basis here, right? If you have, I knew a girl once who was afraid to swim in lakes because her mother was terrified of drowning or something, and so she never really learned how to swim because her mom would not allow her to swim because she was paranoid about drowning. Well, that's a learned thing. So if you have a mom who like goes ballistic if she sees a spider, well, there's a chance that you might learn that fear too. I don't know. Or a fear of dogs, that can be too. All right, cognitive theory. People make themselves feel anxious by responding negatively to most situations and believe they're helpless to control what happens to them, creating great anxiety. There's a lot of weight to the cognitive theory, which is why cognitive behavioral therapy is so important in treating anxiety. Biological views, heredity, identical twins reared together or apart. If one has an anxiety disorder, there's a 45% chance the other one will too, where in fraternal twins, it's only 15. You'll hear about this biological view in the crash course video I posted on Moodle, so I'm not going to dwell here. Some cases may reflect the interaction of biological and psychological factors. So in other words, you're predisposed because of genetics to anxiety, and then you have like things you go through, and together that produces your anxiety. Yeah, most people respond well to treatment, in conclusion. So hopefully this is kind of an introduction. Watch the videos, and you should be, and hopefully you read the article that I went through, and that will give you a pretty good understanding of the basics of anxiety and OCD.